Now, vaping, once marketed as a safer alternative to smoking, has exploded in popularity among South African teens, with nearly 1 in 5 high school pupils now using e-cigarettes. But behind the fun flavours and sleek designing lines and a growing mental health crisis, with research showing that nicotine addiction in adolescents worsens depression, anxiety and even suicidal thoughts. Joining me now is Dr. Terri Henderson, a psychiatrist with the South African Society of Psychiatrists, to unpack the mental health risks of teen vaping. Dr. Henderson, appreciate your time. Thanks so much for speaking to us. Happy Freedom Day, firstly. Now, studies show teens who vape are more likely to develop depression and suicidal thoughts. Why is nicotine so damaging to adolescent brains?
Well, nicotine is a toxin, and we know that the brain is developing right up until the age of 25. So it has particularly toxic effects on specific areas of the brain. So we talk about predominantly the frontal lobe. So it has specific areas functioning, for example, in memory function, impulsivity, and concentration. So that limits functioning at the present, and then this causes impairments in neurodevelopment later on, so that impacting the teen's ability to be a functional young adult and an adult, because it affects memory, organizational functioning, and planning abilities. We know that in the short term, that 7% of teens or tweens, as this starts very early on from age 12, 7% will develop low mood as a result of vaping, as well as increased irritability and anxiety symptoms in the short term. But this also contributes to lasting effects on mental health throughout adolescence as they continue. And we're talking about, once again, low mood, anxiety, impulsivity, and suicidality in the short and the long term.
Now, we understand that many teens vape to cope with stress, but we also understand that it actually worsens mental health. Can you explain this vicious cycle? And obviously, what did teens do when they were stressed before vaping was an alternative?
So there's a bidirectional relationship. So teens who are anxious or have a low mood may vape because they say it makes them feel calmer or less stressed. But then again, vaping causes the same thing, anxiety and low mood. So I think the focus is on trying to offer teens more effective coping skills and healthier coping skills than something like vaping. So I think beforehand, ideally, it would be to talk to someone, but also to find the underlying reason for the anxiety. What are the factors that are driving that? Is it school factors, learning factors? Are there issues with peers? Is there bullying? Are there family factors at home that are driving that anxiety? So very important to understand where it's coming from, because perhaps we can help with those particular issues. And then it's about good self-care that all teens should be practicing. And then specific help around this anxiety in terms of coping skills, such as journaling, getting exercise, healthy interaction with family, healthy interaction with friends, and ways to sort of minimize the anxiety in the short term and in the long term by providing good support.
Now, Dr. Henderson, I'd imagine that for many parents, they're not familiar that their teens are vaping, and those that are obviously trying to stop it. Now, years ago, when kids were taking cigarettes, you know, there were telltale signs, right? So whether it's the darkening of the lips or the odour from the various cigarettes that would allow parents to identify that their children were smoking. What are the telltale signs for kids that are vaping? What can parents look out for?
So unfortunately, the new vapes, they're called pod mods, are specifically created to cause less of a plume. So, for example, you don't see the vapor as much as you would with a cigarette. So it's easier to hide. But from a behavioral point of view, well, sometimes it's really obvious. Kids are vaping when they wake up, when they're getting dressed for school, when they're eating their breakfast. That's quite noticeable. Otherwise, it would be, for example, perhaps the increased irritability, and that particularly shows through when there's addiction taking place. So focusing on how to get a vape, when to get a vape, but a look at irritability and a poor focus on what they need to be doing. So their normal activities, such as schooling and learning procedures and interactions with others. And of course, a lot of parents do find a lot of vapes. So, for example, parents who search bedrooms often find vapes hidden in socks, hidden under drawers. And so it's something that most parents should be looking at, actually, especially for we know that our young tweens and teens is where it starts. So I think a conversation should be had with all tweens and teens about vaping, and then sometimes necessarily to have a look and see if there are vapes in the home and in the school bag, which is really important. And I think the schools are particularly paying attention to vaping because it's happening at schools, and particularly in the school bathrooms. So schools have a challenge there in terms of managing vaping on school premises, before, at lunch break, and after school.
Now, vape companies use candy flavours and social media influencers to target teens. Should South Africa ban these tactics, like alcohol and tobacco adverts, for instance?
Yes, absolutely. This is a terrible thing to do to teenagers who are going to fall for exactly what they've created. Great colours, great flavours, they make it exciting. It's so easy to use. So I think it's really sad that this particular age group is being deliberately targeted with something which is so toxic and really damaging in the long term. I think if we have to think long term, it would make great sense to make this particular substance and in this particular format unavailable, certainly until young adulthood. And it's a great pity that our young tweens and teens are being targeted because of their vulnerability towards using substances and pretty pink Mod Pods with strawberry flavour.
Now, the tobacco control bill has been delayed for years. If passed, would its vaping regulations be enough to reverse this?
Well, we've done very well to limit the use of cigarettes over the last 55 years. And unfortunately, vaping and the way it's come in has unfortunately really accelerated the exposure that teens have towards nicotine. So we're essentially starting all over again and with a bigger problem, because the amount of vaping is extremely large, as you said, 1 in 5 teenagers. So in terms of managing it and education around it, we have to start from again, but actually with greater intensity, because this is, I think, for younger teens, a much bigger issue than cigarette was 10 years ago. And therefore the damage to the developing brain is more significant. If we talk about it, that Mod Pod, the increase really took place from about 2017 onwards. And that's because that Mod Pod looks like a USB and contains up to 5 times more nicotine than a packet of cigarettes. So I think we really have to try very hard to limit this toxin to our young population.
Dr. Terri Henderson, appreciate your time. Great speaking to you and just alerting us and certainly many parents to the impact of vaping.